8 exercises that elderly Japanese people do in bed before walking, and you should too. Did you know that Japan has more centenarians per capita than any other country in the world? The secret is not in the diet, and it is not in the raw fish either. Science has already shown that losing leg strength is one of the strongest signs that the body is aging too fast. The problem is that most people think walking alone is enough to prevent that. Walking is great, and it activates the heart and the lungs, but it is not enough to truly strengthen the muscles. That is why, before leaving home, elderly Japanese people do a few simple movements right in bed, every single morning. No gym, no heavy weights that stress the joints. Just simple exercises done with absolute consistency that activate the muscles and make even the daily walk more effective. So today you will see the exercises they do in bed before walking to keep their legs strong, well into an age that no other people in the world manages to reach. Before we get started, please leave a comment below with your name and the city you are watching from. We would love to know. Exercise number 1, lying marching in place. This is the simplest movement on the list, and perhaps that is exactly why it is the most overlooked. Yet it works like a wake-up call for the nervous system and for circulation, even before you put your feet on the floor. By raising and lowering the knees alternately while lying on your back, you reactivate the communication between brain and muscle after hours of sleep, something physical therapists call gradual muscle recruitment. Regular practitioners are able to get out of bed with less morning stiffness because the hip joint has already been lubricated before the first step of the day. This exercise works the hip flexors intensely, along with the deep core and, to a lesser degree, the quadriceps, since the leg needs to be held in the air for a few seconds with each repetition. To perform it correctly, lie on your back with your knees bent and your feet resting on the mattress. Raise one knee toward your chest as if you were marching, and then return to the starting position, alternating sides. Keep your lower back in contact with the bed throughout the entire movement, gently contracting the abdominals to prevent the back from arching. An extra tip to maximize the benefits of this movement is to synchronize your breathing with the rhythm, exhaling as the knee rises and inhaling as it comes back down. This improves proprioception and the quality of muscle recruitment. A common mistake is performing the movement too quickly, losing control of the lower back, which ends up arching and overloading the area. Start with 2 to 3 sets of 10 to 15 repetitions on each side, progressing later to 3 sets of 15 to 20 repetitions as the body adapts. This exercise typically has no contraindications for most people, but those with an acute lumbar disc herniation or intense hip pain should reduce the range of motion or speak with a professional before continuing. If you feel discomfort in the lower back even after reducing the range of motion, an alternative is to perform the movement with only one leg at a time, keeping the other resting on the bed, which reduces the demand on the core during the initial adaptation period. Exercise number 2, ankle circles. The calf is called by many physical therapists the second heart of the body because it is the muscle that helps pump blood back up to the heart, working against the force of gravity in the legs. During the night, this pump is practically at a standstill, which is why many people wake up with their feet and ankles feeling more swollen or stiff. Ankle circles reactivate that circulation even before you get out of bed and help maintain joint mobility, something essential for anyone who wants to walk safely and without pain. I have observed that people who include this exercise in their routine report less heaviness in their legs throughout the day, especially those who spend a lot of time sitting. To perform it, lie on your back and raise one leg, keeping the knee slightly extended. Slowly rotate the ankle, drawing complete circles in the air, first in one direction and then in the opposite direction. The movement should come from the ankle, not from the hip, and the leg should remain as still as possible. What many people do not know is that varying the speed of the circles, alternating between slow and slightly faster movements, helps recruit different muscle fibers in the calf and further improves ankle proprioception. A common mistake is drawing very small circles, which significantly reduces the benefit to range of motion. Do 10 to 15 circles in each direction for each leg, progressing later to 15 to 20 circles as you feel more control. There are virtually no contraindications for this exercise, but people with recent ankle injuries, such as sprains still in recovery, should perform the movement with a reduced range of motion and without pushing through pain. A specific recommendation for those who experience significant ankle swelling upon waking is to combine the circles with a gentle leg elevation, resting the legs on a pillow for a few minutes before starting the exercise. This further encourages blood and lymph to return toward the trunk, relieving the feeling of heaviness in the legs. Exercise number 3, glute bridge. Few people know this, but the gluteus maximus is the largest muscle in the human body, and yet it is one of the most neglected in everyday life, especially for those who spend long hours sitting. This weakens the muscles responsible for stabilizing the pelvis, which overloads the lower back and can lead to chronic back pain, a common problem among older adults. The glute bridge is one of the most efficient exercises for reversing this situation because it directly activates the gluteus maximus, the hamstrings, and the core without requiring any impact on the knees. A study published in Physical Therapy Journal showed that the electromyographic activation of the gluteus maximus during the bridge is among the highest of any exercise without external load, which explains why it is so widely recommended for older adults. To perform it correctly, lie on your back with your knees bent and your feet resting on the mattress, hip-width apart. Raise your hips toward the ceiling, squeezing the glutes firmly at the top of the movement, and then lower in a controlled manner without letting your hips drop onto the bed between repetitions. An extra tip is to squeeze the glutes firmly for 1 to 2 seconds at the highest point of the movement before lowering, which increases time under tension and enhances muscle recruitment. A common mistake is raising the hips too high, forcing the lower back to arch when in fact the correct movement ends when the body forms a straight line between the shoulders and the knees. Do 2 to 3 sets of 12 to 15 repetitions, progressing later to 3 sets of 15 to 20 repetitions. This exercise is contraindicated for people with undiagnosed acute lower back pain and should be avoided by those who have recently undergone hip surgery without medical clearance for loaded exercises. A gentler alternative for those who are not yet comfortable with the full range of motion is to perform the bridge only halfway, raising the hips just a few inches off the bed and gradually increasing that range over the course of weeks, always prioritizing the correct glute contraction rather than the height the hips reach. Exercise number 4, lying side hip abduction. The gluteus medius is a small muscle compared to the gluteus maximus, but its role is enormous for anyone who wants to walk safely in their later years. It is the muscle that stabilizes the pelvis with every step, preventing the hips from swaying from side to side, which considerably reduces the risk of falls, one of the greatest concerns associated with aging. The beauty of this exercise lies in its ability to strengthen precisely this stabilizing muscle group without requiring any equipment or joint stress, making it perfect for performing while still in bed before even getting up. Regular practitioners report better balance when walking and less feeling of instability when climbing stairs or navigating uneven terrain. To perform it, lie on your side with your legs straight and one resting on top of the other. Raise the top leg toward the ceiling, keeping the hips aligned and without letting the body rotate backward during the movement. Lower in a controlled manner and repeat before switching sides. An extra tip to maximize the benefits is to keep the foot of the raised leg turned slightly downward, as if you were pouring water out of a cup, which increases the activation of the gluteus medius compared to a neutral foot position. A common mistake is allowing the torso to rotate backward during the lift, which removes the tension from the glute and transfers the effort to the lower back. Do 2 to 3 sets of 12 to 15 repetitions on each side, progressing later to 3 sets of 15 to 20 repetitions. People with acute inflammatory hip bursitis should avoid this exercise until the condition improves, and anyone who feels pain when raising the leg should reduce the range of motion. A specific recommendation for those with limited lateral stability is to rest the lower hand in front of the body on the mattress, creating an extra point of support while the gluteus medius is still being conditioned, gradually removing that support as strength and balance improve. Exercise number 5, pillow squeeze between the knees. The adductors, the muscles of the inner thigh, rarely appear in exercise videos for older adults, but they play an important role in hip and knee stability during walking. When this muscle group is weak, the knee tends to collapse slightly inward with each step, a movement pattern that increases joint wear over the years and can contribute to chronic pain. This exercise is practically invisible in terms of physical effort, but extremely efficient at reversing that pattern since it activates the adductors isometrically, meaning without requiring the joint to move. When you include this exercise in your morning routine, you are training the body to generate more stability with every step of your walk, something that most people never train in isolation. To perform it, lie on your back with your knees bent and place a thin pillow or cushion between your knees. Squeeze the pillow firmly, contracting the inner thighs, hold the contraction for a few seconds, and then release slowly without letting the pillow fall. An extra tip is to combine the pillow squeeze with a gentle contraction of the pelvic floor at the same time, which broadens the benefits for overall core stability, something especially relevant for older adults. A common mistake is holding your breath during the contraction, which unnecessarily raises blood pressure during the exercise. Hold each contraction for 5 to 8 seconds, repeating 10 to 12 times, and then progress to contractions of 8 to 10 seconds with 12 to 15 repetitions. This exercise is safe for virtually all populations, but people with a recent hip replacement should confirm with their doctor whether they are ready to perform resisted contractions in the inner thigh area. Those who do not have a small pillow available can use a folded towel or even a soft ball as an alternative, as long as the object provides some resistance to the squeeze. What matters is not the item chosen, but the quality of the contraction, so it is better to perform the movement slowly rather than squeezing quickly without control. It is worth remembering that, although it may seem minor, it is this type of isolated stabilization that supports larger movement patterns such as walking and climbing stairs. So do not underestimate the impact of making it a daily habit. Exercise number 6. Lying quadriceps stretch. Spending the entire night with the knees slightly bent, a common position during sleep, tends to leave the quadriceps and hip flexors somewhat shortened by morning. This explains why many people feel a certain stiffness in the front of the thigh during their first steps of the day, even before leaving home for their walk. Keep in mind that walking requires full hip extension with every stride, and if these muscles are shortened, the body compensates with shorter and less efficient steps, which reduces the cardiovascular benefits of the walk itself. Stretching the quadriceps before walking prepares this muscle chain to move through its full range, making the walk smoother and less taxing on the knees. To perform it while lying down, roll onto your side, bend the top knee, and hold the ankle with the hand on the same side, gently pulling the heel toward the glute without forcing it. Keep the hips projected slightly forward, which deepens the stretch along the front of the thigh and the hip. An extra tip is to keep both knees aligned on top of each other during the stretch, preventing the top knee from drifting away from the body, which would reduce the effectiveness of the movement. A common mistake is pulling the ankle with excessive force right from the start, which can cause unnecessary discomfort. The stretch should be progressive and never painful. Hold the position for 20 to 30 seconds on each side, repeating 2 to 3 times and progressing later to 30 to 45 seconds per side. This stretch is contraindicated for people with recent meniscus injuries or knee instability that has not been evaluated by a professional who should seek guidance before flexing the knee through its full range. Research in the biomechanics of aging has shown that loss of hip range of motion is directly related to a reduction in stride length in older adults, which reinforces why small daily stretches like this one have such a relevant cumulative effect over the years, even without producing visible gains from one day to the next. For those who cannot comfortably reach their ankle with their hand, an alternative is to use a resistance band or a strip of fabric looped around the foot, holding the ends of the band instead of the ankle directly. This reduces the demand on the shoulder and elbow, making the stretch accessible even for those with limited arm mobility. Before we continue, do not forget to subscribe to the channel and turn on the notification bell. Having constant access to science-based information is what will help you progress with long-term health in the world of exercise. Exercise number 7, heel slide. This is an exercise widely used in physical therapy and knee rehabilitation protocols, and for good reason. It works joint mobility in a controlled manner without any impact whatsoever, making it perfect for those who are concerned about hurting their knees. A mistake I see many people make is thinking that joint mobility only matters after an injury, when it should be worked on preventively every single day. The heel slide improves the lubrication of the knee joint by stimulating the production of synovial fluid, and also gently activates the quadriceps and the hamstrings, since the leg needs to control the movement throughout the entire range, both when bending and when straightening again. You will know you are doing it correctly when you feel the heel gliding smoothly over the mattress, without excessive effort from the ankle to push the body. To perform it, lie on your back with both legs straight. Slide the heel of one leg toward the glute, slowly bending the knee as far as is comfortable, and then slide it back until the leg is fully straight again. Keep the movement slow and controlled from start to finish, feeling every inch of the path. An extra tip is to rest your hands lightly beneath the knee during the return phase, helping to guide the movement without overloading the joint, especially for those who are just starting out. A common mistake is performing the movement too quickly, losing control of the eccentric phase, which is precisely the part that contributes most to long-term mobility. Do 2 to 3 sets of 10 to 12 repetitions on each leg, progressing later to 3 sets of 15 repetitions. This exercise is generally well tolerated even by those with mild knee arthritis, but in cases of acute pain, recent swelling, or immediately following surgery, it is essential to obtain medical clearance before resuming the movement. A specific recommendation for those who feel some friction or mild discomfort when bending the knee fully is to reduce the range of the slide, going only as far as is comfortable and gradually increasing that range week by week, rather than forcing the full range right from the first attempts. Daily consistency matters far more than the range achieved at the very beginning. As an alternative for those who find the mattress too soft, the same movement can be done seated in a firm chair, sliding the foot along the floor instead of the heel along the bed. Exercise number 8, lying bicycle. We close the list with an exercise that many people have seen before, but few know how to perform efficiently for the mobility and circulation goals we are pursuing here. Unlike the more familiar abdominal version, the lying bicycle that matters in this context is the pedaling motion in the air, focused on the hips, knees, and leg circulation, not on the abdominal muscles. This movement simulates the pedaling action, alternately activating the hip flexors, the quadriceps, and, to a lesser degree, the hamstrings, while also stimulating venous return from the legs, which were practically still throughout the entire night of sleep. The beauty of this exercise lies in its ability to combine mobility, light muscle activation, and circulatory stimulation in a single movement, closing out the sequence before you finally put your feet on the floor. To perform it, lie on your back and raise both legs, forming a comfortable angle with your torso. Begin pedaling in the air, alternating the legs in a continuous circular motion as if you were riding a real bicycle, keeping the lower back resting on the bed at all times. An extra tip is to keep the movement slower and more controlled rather than fast, since the goal here is not intensity but mobility and circulation. Excessive speed tends to cause the lower back to lose support. A common mistake is allowing the lower back to arch and lift off the bed during the pedaling, which can cause discomfort in the area. If that happens, lower the height of the legs until you feel the lower back fully supported again. Start with 20 to 30 seconds of continuous movement, resting and repeating for 2 to 3 sets, progressing later to 40 to 60 seconds per set. This exercise should be avoided by people with uncontrolled blood pressure when raising the legs above the level of the heart for extended periods, and also by those who feel lower back pain when keeping the legs elevated, in which case the lying marching in place is a safer alternative. A common mistake is raising the legs too high right from the start, attempting to form a right angle with the torso when a more open angle closer to the bed is already sufficient to activate the muscles without overloading the lower back. Over time, as the core gains strength, it is natural for that height to decrease spontaneously. If you prefer a gentler version for the first few days, rest the backs of your hands under the lower back during the movement, which provides extra support while the core is still adapting. If you enjoyed this and beyond the bed, you also want to discover which exercises elderly Japanese people use to strengthen the rest of the body using only a wall for support. We have left a video appearing on the screen right now, showing each one of them. These are exercises that, in addition to strengthening the muscles, also preserve the joints, so make sure to check it out. Thank you for watching all the way through, and may God bless you, my friend.